Hi everyone. By now, I'm sure many of you will have heard my announcement that I'm moving to NHS Tayside as their interim chief executive. So before we do the Q&A today, I just want to record a short message to share with you what a privilege it has been to serve as your chief executive for the last 3 years. Together during that time, we have faced some significant challenges, and it hasn't been easy, but with your dedication, your commitment, and unwavering desire to deliver the best care possible for the people we look after, it has remained an honour to be the chief executive. As I move on to this new chapter for me, I do it with real mixed emotions. I have come to love working with NHS Grampian and much broader than that with our partners and the people of Grampian. However, I do know that NHS Grampian is going to remain in strong hands, and Adam Caldwell's, who many of you will know, and Adam has been my Deputy Chief Executive for 3 years, is going to take up the role of Interim Chief Executive for NHS Grampian. Adam knows this organisation as well as most people, as Adam has worked for NHS Grampian for around about 30 years. However, I do know we have some people who have worked in NHS Grampian for longer. However, he does know it really well, and he also knows the opportunities around the broader health and social care integration work that we need to continue to do to make sure that we can meet the expectations of the public. I know that I will carry lessons that I have learned here with you into my future role, and I hope that my short tenure in Grampian, I've been here since 2015, has at least made a tiny difference to some people in the huge cog that is the NHS. And I'm going to start in Tayside on the 11th of December. So before I go, which is really soon now, Adam and I are going to make sure we do a few additional visits out into Aberdeenshire, into Murray and Aberdeen City, to make sure that I can see as many people as possible before I move to Tayside. So thank you again. Thank you for your support. Thank you for all the lovely messages I've received already this morning. And I look forward to working with you in my role as NHS Tayside's Chief Executive in how we move things forward in the North region. Thank you.
Okay, welcome back, and thanks for watching what is now episode 23 of Ask Caroline.
Goodness me.
We were very ably joined by Adam Caldwell's last time round, but I'm sure you'll be pleased to see we can welcome back Caroline today. How are you?
I'm good, thanks. Yeah, I think colleagues that watch this will know that I had some time off to support my husband and our family. So I've been back for 4 weeks, and feels as if I've never been away. And for those of you that know my husband, who has clearly worked in Grampian for, gosh, a long, long time, he continues to progress. So that's really good. And care has been amazing.
That's good to hear that the care's been amazing. So it's good to have you back, Caroline. I know you like to update people in progress with questions before we get started with the new ones, Caroline. So have you got anything for this session that you would like people to know?
Yeah, I think the only thing that I suppose it's a small nugget of progress, but not, I'm sure, where colleagues wanted us to be. So I don't know if most people remember we had numerous questions, as we do every year, about the temperature in particular areas, and that is only exacerbated in the summer. And so we had questions about shorts and summer uniforms. There clearly isn't a straightforward answer to that, and like everything, the wheels of bureaucracy turn slowly. And so the only update is that we have now established a short life working group. They are expected to report before December, which is pretty soon, really, isn't it? And because we're in November now. and that we will have a position that we've developed in partnership, which is the important part, on what uniforms need to look like going forward to manage the welfare of staff and the temperatures. Some of the stuff that comes up for people around this are relating to health and safety, and you can think about that from a temperature perspective and then from a PPE perspective, as well as the professional aspects to it. So we're on it, not on it fast enough, and I apologise for that, but we will be in a position to have an amendment or an addendum, I think, to the uniform policy or dress code policy. I can't remember the title of it now, Stephen, you might know, for next summer.
Yeah, thanks, Caroline. Yeah, I think from memory it's a uniform policy, so apologies if we've both got that wrong. I'm sure we'll receive feedback. Absolutely.
Yeah.
Okay. That's great. So we've got a few questions then. So the first question is from Heidi Taylor, who's a staff nurse in the Women's Day Clinic. And Heidi asks, who is responsible for the cleaning of the Lady Helen Car Park? The stairwells and lifts give a very poor first impression of the hospital.
Yeah, thanks, Heidi. So the responsibility of the cleaning sits with us. So it sits with our facilities team. And I know that, like every other team, they are stretched with what they can do. So obviously work is prioritised. And so I've actually spoken to Paul, who was our executive director for that area, and Gavin Payne is holding that portfolio at the moment. But I've spoken to them about just how we're managing to balance that. And I'd actually spoken to them about there's posters in the Lady Helen Car Park stairwell, some of them, and they're about the visiting processes that we had in place during COVID. So I've asked for a couple of times for them to be taken down. So prompted by this question, I will reach out and double check where we're at, but I know that that issue has been raised in other forums, and that Gavin and the team are trying to work out how they can prioritise that. And of course, everybody, and I include myself in that, has a responsibility to maintain the cleanliness of our sites and to challenge others that are not. So I think we've all got a bit of a responsibility there around it, but I know that Gavin will be picking up with the team just how do we make sure we've got the right workforce around that.
Thank you. Okay, the next question is from an anonymous healthcare support worker who is written to say that my question is being asked on behalf of a lot of my bank support worker colleagues that I've spoken to over the past couple of years. We kind of feel we have been forgotten about when it comes to the rebanding to Band 3. It has been months now since the topic has been brought up about this. It seems like our views have been forgotten about. We're still doing shifts in areas where we were doing the work of Band 3 workers, but still no word on our upgrade to Band 3. When we call the bank office to ask about this, they apparently have no clue what's going on, and we are told we just have to wait. Any feedback, help or advice on this would be greatly appreciated, Caroline.
Thanks for the question. And so firstly, I'm going to take the opportunity to say a huge thank you to our healthcare support workforce, be they substantive colleagues or bank. And actually, you have most definitely not been forgotten about. In fact, the contribution that you are making to the healthcare system in Grampian is huge. And I know that through a slightly different route, which is I had the pleasure of spending the morning looking at our finances this morning, and I know that we are utilising 400 full-time equivalent healthcare support worker colleagues from the bank above and beyond our establishment. So you have most definitely not been forgotten about, and your contribution is self-evident, I think, in the value that people place on you. However, I recognise the frustration that you must be feeling. So actually, Stephen, you and I spoke about this being at GAPF recently. So I think it's going through the right processes, and I get that that will be frustrating and slower than people would like. So a couple of things for me, and then Stephen might want to add something as Stephen, because Stephen chairs our area partnership forum. So this is not a straightforward we just swap everybody that's a band 2 onto a band 3 salary. It's based on, firstly, the skills and competencies of colleagues and what they do. The job description and the skill set is different for colleagues who are working in a Agenda for Change band 2 role and an Agenda for Change band 3 role. So that's the first thing. The second thing is that even if you've got those skills and competencies, particularly in the bank, that has to be what the ward or the environment is that you're going to. That has to be what they need. And we still have a huge amount of need for colleagues who work at band 2 level as well as band 3. If it was just a straightforward switch over, then that would all have been done, although that would have been a huge issue for our payroll team, and I get that. So some of the nuances of this, as I understand it, are we've done it for all substantive colleagues now, I think. Again, we'll get feedback pretty quickly if I've got that wrong. And the next phase of this is to do it for colleagues who have a substantive contract and are on the bank, because they will naturally just like for like transition. So I think the key group where we're possibly going to take the longest with, and this might not be what you want to hear, but trying really hard just to be honest in my answers, is those colleagues who only have a contract on the bank. And that's because we have to ascertain skills that you have, and then the skills that wards or other environments need when they seek bank colleagues to come and work with them. I know it's not straightforward because I spoke to June, our nurse director, a few weeks ago, and June had said that she was trying to get guidance nationally around how other staff banks were doing this and doing it well. So that's where we're at, but I don't know, was there anything else from GAPF, Stephen?
No, Caroline, I think you've summarised what GAPF you were advised at their meeting in roughly the middle of October. Okay. And that was the last time that we received an update. And I guess while I can well imagine it can feel to colleagues as if nothing's happened, and and therefore because nothing's said, then maybe nothing is happening. But of course that's not always the case. And equally for those healthcare support workers who are substantive, it took longer, I think, initially than NHS Grampian had estimated that it was going to take. But for something like a regrading process, it's important that it's done correctly, and that all the nuances you've described get covered. So I'm as assured as I can be, and certainly GAPF were told that the same team of people that dealt with the substantive staff are absolutely dealing with this, but it will take some time. Okay, thank you. Next question, question 3 is from Sarah McIntosh at Saltoun Surgery, and she asks, as we have a large family-based workforce as an organisation, I think it's imperative to encourage the workforce back into work. With childcare being so expensive, whether that be in a private nursery or using childminders, and with funded hours not starting until the first term after a child's birthday, it really is not cost effective for many of us to use childcare. As recruitment is so difficult, I wondered if now is the time to start looking at smarter ways of working and utilising current workforce by expanding the NHS Grampian childcare provisions we have on offer to reduce the barrier to folk coming back or indeed working extra hours. The existing provision isn't accessible for most people in the Aberdeenshire and parts of Moray, for example.
Yeah, thanks, Sarah, for the question. And it is a real challenge, isn't it? And I say that as the chief exec. I say that as a mum who had to find childcare for my 4 children while I was working throughout my career. And I say that now as a gran, actually, when I'm asked if I can look after my grandchildren, and I have to say, no, I'm really sorry, I can't. So I think the dichotomy of trying to balance work and parenting is just incredibly challenging, and knowing that your children are well looked after and having fun when you're at work is really important. So I do take it really seriously. And I also recognise that we have limitations in regards to what we can do to affect what in essence is national policy. So we can try to make a difference, and we do with the infrastructure that we have. Now, I might be wrong in saying this, but I think we are the only health board in Scotland that has an internal nursery system, and we've got 2 nurseries one in Cornhill site and one at Woodend, both who get excellent reviews, excellent feedback, and I think the standard of care for the children that get access into those is really super, and huge credit to the colleagues that work in those two nurseries. And I think the last time I looked, we were caring for over 250 of our 250 children in those nurseries. I might have the figures wrong. I'm sure Lorraine Hunter, who is in charge of it all, will come back to me immediately if I've got the numbers wrong. So apologies, Lorraine, if I have. And I think the other thing is that we do subsidise that and have a salary kind of scheme for people to pay directly out their salary. So I think for people that can get access to our nurseries, that works well. That's certainly the feedback I've got, but I recognise that that goes nowhere near touching the sides of, we've got 17,000 colleagues who work across Grampian. So to meet the childcare needs of those that need childcare, I think would be an impossible task, if I'm honest, for us to do that alone. I know that I've had recent conversations with Tom, who's our Director of People and Culture, to say, what else could we do, perhaps in partnership with our local authority colleagues, which might mean that the access or the position of these childcare facilities might better meet colleagues who are working in Aberdeenshire or Murray, but we haven't found a way forward with that yet. So I think all I can say, Stephen, in answer to Sarah's question, is I recognise the importance of it. I know how expensive it can be, and we are doing our best with the childcare two nurseries that we have. And there are other options around contracting with private groups, etc., private companies that other health boards do, but we've not gone down that route yet. But I know that Tom and Lorraine are actively looking at how we can accommodate more children. One of the key things in that, I think, is our built infrastructure. The space just isn't big enough where we've got our nurseries to have any more children safely there. So we're governed absolutely by the Care Inspectorate, as you would expect. So yeah, it's not enough, but it's all we've got at the moment. And in light of the current financial position, I can't see that changing in the near future, I'm afraid.
Okay, thanks, Caroline. Question 4 is from Donna Petrie, who's a housekeeper in the Royal Aberdeen Children's Hospital HDU. And Donna writes, "Hi Caroline, I met you a few months ago on the 3rd floor along with some of my work colleagues from the Children's Hospital HDU. I'm currently the housekeeper for HDU and wear the same uniform as our domestics. I did ask you if it would be possible for the housekeepers from Royal Aberdeen Children's Hospital to wear a different colour of uniform, as I think this would help differentiate and increase understanding of different roles for other staff and patients. Please, could you look into this for us?"
Yeah, Donna, nice to hear from you. Uniforms are a real issue, aren't they? I mean, they're so, you'll know this. Well, the first question was about uniforms, wasn't it, in the summer? And I think uniforms are so important to people because it is about identity and value, and Donna, you'll be no different in that, as our domestic colleagues would be, or others. And so we work with the National Uniform Policy, and as I understand it, for colleagues who are in support roles, so housekeeping, domestics, portering colleagues, all who are utterly vital to the care that we deliver every day, are to be distinguishable from colleagues who are in direct caregiving support roles. So our healthcare support workers that deliver direct care, they are in a kind of pale blue tunic. And then colleagues such as yourself, our domestics, and our portering colleagues, they are, I was going to, not so much in direct patient roles. Sorry if I go off piece a little bit here, Stephen, because actually, I know that our porters, our domestics and our housekeepers interface with patients and their families every single day. So that's not what I'm saying. So what I'm saying is deliver personal care. So you wouldn't, a member of the public the reason national uniforms came in was to allow the public to be able to identify particular roles. So those healthcare support workers who can deliver personal care to washing and helping people to the toilet, etc., they would be in a pale blue uniform. Colleagues who still provide support and care, but not on a personal level that I've just described, would be housekeeping, domestic colleagues, and portering colleagues. And I get that everybody wants to be unique and be identifiable, and that's why we have to go beyond the uniform and think about how we introduce ourselves, our names, and the interface and the communication that we have with the public. So, Donna, I can't create a different uniform for everybody. It's a national uniform, but suffice to say, our housekeeping colleagues play a key role in the delivery of care in Grampian, and you are more than just your uniform. So again, not the answer you'd want to hear, but hopefully my message about how much you are valued comes across.
Yeah, thanks, Caroline. So there's a follow-up question that's also on uniform differentiation, and this one's from Sam Thomas, who is an out-of-hours nurse in Aberdeen City. And Sam states, the national uniform standards, the navy tunic with blue piping is to be reserved for use by senior charge nurses and team leaders in community settings. Why in NHS Grampian is it commonplace to see district nurses, often multiple in one team, all wearing the navy tunic? The national standards make it clear that the purpose of the navy tunic is to highlight nursing leadership rather than banding or clinical expertise. Hence, why do we not see specialists? Hence, that's why we don't see specialist nurses in navy uniform. Are there any plans to remind local teams of the correct uniform for staff, as this can be confusing?
Stephen, sorry, I missed. Was that anonymous or was there a name with that?
It was Sam Thomas, who's an out-of-hours nurse in Aberdeen City.
Sam, thanks for the question, and I don't know the answer to that, but I do remember quite a lot, a bit like Donna, and asking for you know, how could we apply that locally in the same conversation around these are national uniforms. I do vaguely recall a conversation about district nursing, but if I'm honest, I can't remember where we got to in that. There was something about team leaders in it. However, I know that June Brown, who's our nurse director, when you said, are there any plans? If they're not, there will be. Very quickly, June will seek to understand. But your description of colleagues that should be wearing the senior charge nurse uniform are senior charge nurses, and that's it. And there is a big debate around clinical nurse specialists and advanced nurse practitioners, but as far as I can remember, that has remained the extant position, which is senior charge nurse uniform is senior charge nurse uniform. But as I say, there was a wee nuance, I think, about the team leader in the district nursing team, but I just can't remember it. So, June Brown, if you're listening to this, please can you do a bit of sense checking, and we can come back possibly in the next Q&A or in the brief around where we're at with this.
Yeah, okay, thanks, Caroline. Yeah, as you say, I think that's three uniform questions we've had in today's episode, and I know we've discussed it in previous editions of Ask Caroline as well. So back on to another very popular topic, if that's the right word. So on car parking, Kevin Galloway, advanced dental technician at Aberdeen Dental Hospital, has been in touch with a comment observation about the parking restrictions on the Foresterhill site. So Kevin says the signage throughout the Foresterhill site seems pointless if the parking fines are not enforceable and and therefore do not deter people. It seems like it just wastes time and resources.
Yeah, so Kevin, thank you for that question. And I think there's a couple of things that I can respond to that. It's not really a question, is it? It's just a statement from Kevin. So I'll respond. And I think COVID, that the parking was suspended during COVID, the kind of restrictions, and we tried to be really flexible to support colleagues as well as the public to park. And I know that I have a pretty strong value base that colleagues do the right thing. And I know that previously when I gave that answer, about parking and staff parking in patients' car parks. And I said something along the lines of, we need to trust our colleagues to manage themselves, and the fact that patients and families need to park as well. Got pretty strong pushback from our parking team to say that's all good and well, Caroline, but actually the reality of that is we're trying to manage it every day, and it is a tough job. So the parking restrictions were paused during COVID. We haven't stepped that back up again. I do have an expectation that people park in the designated areas, and I know that's really difficult. And I also think we have to spare a thought for colleagues that are trying to manage this every single day as their job. And you're right, it's soul destroying for them as well when they are trying to create access for patients and the public. But this conversation, I'll be surprised if this is the only parking question we get, Stephen. I know that this is a really contentious topic at the moment.
Okay, thank you. Now, I'm not sure if the next point actually also comes from Kevin or if it's an anonymous colleague.
Okay.
But so this paragraph talks about, well,
somebody more important than me, Stephen.
I find that hard to believe. So if Mike chooses to leave that in, I guess it's real and unedited. And yeah, clearly, a reminder to myself, I need to put "do not disturb."
Oh, well, I haven't done that either. So I've just nobody's trying to get in touch with me, obviously.
Anyway, yes, sorry. So this next statement may be from Kevin Galloway or it may be from an anonymous colleague. But parking at the Dental Institute and Hospital and Argyll dental practice has always been difficult for patients. The university car park opposite the building remains barely used, and it would be beneficial for staff in these two buildings to be able to park there. I am aware of a cost being associated with the parking here. Could an agreement between Aberdeen University and the dental hospital not be negotiated to allow staff to park there and ease the pressure on patient parking within this area? As I've read that out, I think it's probably from Kevin, since Kevin does work in the dental hospital.
Okay, yeah, and valid point. There's nothing more frustrating than seeing a whole heap of empty car parking spaces when you know that patients are driving around trying to find somewhere to park, or indeed colleagues. So I think, so Ted Reid who's our head of logistics. He's unfortunately got the short straw and deals a lot with these car parking questions that everybody is asking just now, especially with the Lady Helen Car Park, where we're at with that now. And I seem to recall that there was a short life working group looking at that, and I think we did negotiate a kind of interim parking agreement, but there was absolutely no appetite for that to become a permanent fixture. So I think the best thing I can do without guessing around where we got to with that is get Ted just to either update us on the most up-to-date conversation with the university and put it in the daily brief when this goes out, or if he's not got it by then, as soon as we can after it. But yeah, I think it's a good question. I'm sure we have looked at it, and again, a bit like the parking penalty stuff during COVID. I think we got an interim agreement during COVID, but I think that's lapsed now.
Okay. That's Caroline. So since you mentioned Ted Reid and you mentioned the Lady Helen Parking Centre, there has, I'm reliable informed there have been a few folks have got in touch since, looking for an update on the latest situation around the Lady Helen Parking Centre and the potential change of use application. So have you got anything you'd like to update on?
I think this is it's a really difficult one, isn't it? Because, the job is tough enough without actually, even before you get to your work, having to be completely stressed by not being able to park. And I know the huge added benefit that we've had to I can't remember how many spaces we've had from the 6th floor up in the Lady Helen Car Park for some time now. And I think people have become quite accustomed to that. And I know that when I'm on site, if I need to park, then quite often that's where I will try to go, although that's for short periods of time. So where we've got to with that is a real recognition of the importance and impact that that's having. I think there's a number of things underway to ask colleagues what they think the solutions would be. I'm aware that there is also a growing concern with our trade union partners around this, and I think I've actually got a meeting in my diary, looking at the calendar here, and it's tomorrow, to talk about a petition that has been signed to try and raise the profile and importance of this for colleagues in Grampian. So the original build was based on the premise that the planning permission was for patients and family, and we can't be in breach of planning permission. We've got to comply with that. But we were given, again, during COVID, we were given a pause to support colleagues. And obviously we're stepping back from that now. So applications will go in. An application is in the process of going in to amend the planning permission. I don't know if that will be successful or not, because the overarching contribution, as well as the parking issues that we're facing, is about net zero, and how do we, as one of the biggest employers in the North East, contribute to net zero. So there's lots of conversations underway with local authority within the system to understand where we're at with the Lady Helen Car Park, and all I can do is to continually update colleagues with that information through this, as well as the short life working group and things that are underway. And I'm sure also through partnership you will hear from our trade union colleagues any updates that specifically are with the union you are supported by.
Yeah, thanks, Caroline. Yes, Grampian Area Partnership Forum has regularly been discussing this, and certainly again at last month's meeting, Ted and it was Emma Pettis from Corporate Comms came along and gave us a sort of summary of the results that the NHS Grampian sort of internal staff survey had about the Lady Helen Parking Centre. So all the right moves are being made, and I think you actually it's always been a controversial issue, but yes, I mean it's being discussed in all the places that staff who have got an interest in this would expect, and and would want them to be discussed. So as you say, well, it was in, I think it'll be one of last week's daily briefs, there was an update given. So as and when there are developments, I'm sure that will be communicated in all manners, including probably through another question or 5 through the Ask Caroline.
Yeah, and I know I'm laughing car parking and uniforms, but I'm not. I do know how important they are, and even the it's linked to the childcare question earlier. How do we make it easy for people to come to work and actually do the job? But the questions we are dealing with here are about factors that are, they're not even part of the job. I know it is part of the job, but it's just so important to try and get the conditions right for people to come to work and know that they can park, or they can get to work safely, they can get home safely, and for those that need childcare, they've got that as well. So yeah, it is really interesting, just the general welfare questions that come through, I think.
Absolutely. Okay, change of topic. So question 7 is from Dr. Nair, who is a consultant paediatrician, and is emailed with comments. Hi Caroline, I'm not sure why we do not have an NHS fleet service where a car is leased to NHS workers through a salary sacrifice scheme. This will hugely benefit a lot of workforce who are struggling with the cost of living crisis, but do need a car to travel to work. This seems to be a well-established system in the NHS in England, I believe through, I think it must be a company called NHS Fleet Service.
Yeah, so I think we've spoken about this before, and I can't quite recall the detail, but so I don't know the answer to that. I don't know why we don't do it, and we might even have started the process of understanding what it would take to do it now, hopefully. But my understanding is that if we were to progress with it, then it would be an independent or a private contractor that would facilitate that for us anyway. So I don't know if there's been anything through GAPF, because that's clearly a route it would have to go, Stephen. Yeah. But I think the NHS fleet is it's a private company that does the kind of contracting work. So you would still, individual employees would still be dealing with that. We wouldn't have an NHS Grampian fleet. But I mean, I don't know why we wouldn't do it. But I'm sure we've answered that. I'm sure I've had a question similar to that before.
Yes, yes. You're not the only one sensing sort of deja vu. That there was a question a few months ago around about electric cars, and so certainly GAPF, and I think it was back in the August meeting. GAPF had a paper submitted by colleagues in the terms and conditions subgroup, which is as that name sort of suggests, it's a mixture of management, HR, staff side colleagues, and with a lot of input from Lorraine Hunter, on behalf of payroll, talking about a lot of terms and condition things, including all the salary sacrifice schemes. So we've got the cycle to work scheme, and certainly locally there is a company called Tusker, who there have been initial conversations that the terms and conditions subgroup have had with Tusker, because Tusker provide exactly this sort of scheme to, I believe it's certainly Aberdeen City and Aberdeenshire councils. So GAPF was asked in August, would GAPF agree to further work being done to actually make this a reality? And the short answer was yes. So that work is sort of underway, and as I say, it's unlikely there'll be this particular company called NHS Fleet Service, but there are, at the risk of sounding like one of those ridiculous television announcers, other companies are available.
Yeah. So that's good. So yeah, hopefully that'll be something positive soon.
Yeah, thanks, Caroline. Okay, and now we've got a couple of questions that were carried over from episode 21 that weren't asked, and so go on.
That means you saved the tough ones for me because Adam couldn't answer them.
Far be it from me to cause trouble between yourself and Adam. Go on, Caroline. I co-chair GAPF with Adam.
Oh, that's right. I forgot. Yeah, okay.
Yeah. So I'll hold the coats, perhaps. Right. So question 8. Are there any plans to increase the capacity of the adult autism assessment team? They currently have funding for 4 hours per week and have a waiting list of nearly 1,000 people. It is 1 year from referral to triage, and then a year again on top of that to diagnosis. The NHS Grampian Staff Equalities team recently had a neurodiversity meeting, and it was the most attended yet. There's clearly a need for staff with neurodiversity to be supported, and if we can't even get a diagnosis, how is that going to happen? A staff team working on diagnosis and support would change a lot of staff's lives for the better, I think, and that appears to be an anonymous colleague that submitted that.
Gosh, there's quite a lot in that, Stephen, and I'm not quite sure if the angle is about colleagues with neurodiversity in our system, or teams that aren't specialists in that supporting their patients, or indeed access for patients. So I'll try and respond to all three, and I'm sure whoever submitted the question, if I get it wrong, just come back and say that actually wasn't what I meant. So I think to start off with, I'm going to start off with something really positive, actually, which is the Equality Network group and the attendance at the neurodiversity session, which was just fantastic, and I think showed a real enthusiasm, I'm not surprised by that, around how we support the population in a different way, and indeed the community of colleagues who work across health and care and need additional support, and need us as employers to make sure we are meeting those needs. So that was a really positive event, and like everything, understanding the scale and extent of the challenge is a really important thing. And then to move back to the data that you described at the beginning of the question, around the access waiting time for the public to have assessments, so autism being one. I mean, nobody would think that's an acceptable time to wait, and for families that are experiencing that just now, then I think that must be incredibly difficult, and we need to find a way to invest in the teams that can deliver that to reduce those waiting times. So I think the things that will help us with that, so I know the local team are investing and have put in place some additional colleagues to try and manage the waiting times in a different way, but that still won't achieve access at a scale that we would want. It's also really helpful that national policy is focusing and has a real emphasis on this, and so that means that funding, when we get it, is focused on different things. So there's a real shift in the funding that we are seeing for mental health, which is great. Although we need to see that recurringly, and I've spoken a couple of times about the financial challenges. So national policy is helping us locally. I know the team are doing their absolute best to prioritise this and to find a way to manage the waiting lists in a different way. I know there is other work going on around kind of coaching and peer learning, if you like, around neurodiversity, and trying to understand what can, I suppose, the broader, more generic services do to improve patient care. So if you have somebody who has a neurodiversity and they're with you for another condition, then what could the learning be around that? So that's one thing that I know the team are doing in providing education and drop-in sessions. I'm not sure where they're advertised, but we'll make sure there's a link in the daily brief. And then, of course, there is the support for colleagues who are working in our system, and we could, what more could we do to improve your experience of having neurodiversity and working in NHS Grampian? And again, I believe there are access to education and coaching, and perhaps some peer support, but we need to get Mike to put the links in to the daily brief. But that's kind of my understanding of it, and we are trying really hard to make sure that we are paying as much attention to our population with physical ill health as well as mental ill health, and that's again, as I say, supported by policy direction.
Thanks, Caroline. Okay, I think we're now on to the last question, which has come from the HEPMA team. So their question is, Caroline, why do you think it's important for NHS Grampian to implement HEPMA? It'll bring changes to how staff have worked historically. How do you foresee the staff perspective and the experience of it?
So this is really interesting because I've been around HEPMA for some time, and at the beginning of this conversation, you asked how I was because I've been off, and so I've had first-hand experience of watching the team transition from the traditional way in which we managed medicines prescribing and dispensing to using HEPMA. And I've had some interesting conversations in the ward around that. And that's been in Ward 112, and I have to say that the care has just been fabulous there, as has their frustrations, I think, at times with HEPMA. So I think I have supported HEPMA from the outset. I think that digital solutions are absolutely something that we need to embrace and recognise that they are, any change, any behavioural change is challenging. And if we look at how long we have been dispensing, prescribing and administering medicines in the same way, then you know, I think the HEPMA team are doing an amazing job of supporting colleagues in implementing this new digital system. So I think the overarching thing is safety. Is it financially more economical? I don't think so. I've not seen a case for that. Is it safer? Absolutely, and I have seen the evidence for that, and that has to be our big focus on the safety aspects. Medication errors remain significantly underreported in not just Grampian system, but in all of our systems. Medication errors and the impact that that has on colleagues and patients, again, from a safety and quality perspective, are really important. So I think we've got it rolled out now about 70% of our clinical areas. And so seeing the feedback from those teams would be really important. I would imagine what we will hear is it's difficult to get your head round. It's a change in practice, but also it's much easier to see the prescriptions because you're not trying to decipher handwriting, and that it's got a really clear audit trail in regards to what medicines have been dispensed, prescribed, and administered. So yeah, I mean, there's still a human element of it. I absolutely think I've spoken to doctors in training, I've spoken to nurses, and whilst some of them, I'm sure, would love to go back to handwritten cardexes because you can just chase the doctor around the ward to get it written up, and now you've got to kind of log off and log in and stuff like that. The overarching safety benefits, I think, are self-evident, and that's what we have to focus on. Does that answer the question, Stephen, do you think? I kind of went off on.
No, it certainly seemed, it felt to me like you've answered the question, and I think actually, you're linking it to the experience, which we reflected on at the start of this. I think that that sort of proves how important it is. So I would like, well, I guess if the HEPMA team themselves feel that something's been missed, just like any of the brave souls who submit questions to you,
just get back to me.
Absolutely. If they've got a follow-up or you have a concern, please let us know.
Yeah, absolutely.
So, okay, Caroline, thank you very much for your time again. Is there anything you want to add before we finish this month?
I don't think so. No, I think that the key things that we've covered, it's interesting. Uniforms and parking, it's so important, and we'll just keep working our way through it. But no, nothing, Stephen. Thank you, and I hope you enjoy the rest of your week.
You too, Caroline. Thanks again, and we'll see you all again next month.